Hello, everyone. You know, Jude said that I asked him what he was doing here. He could have easily asked me, what am I doing here? I am the substitute for the substitute speaker. Joel Barthelemy, who's on the board of AZBio, happens to be in Washington, D.C. today, among other things, visiting that resident at 1600 Pennsylvania Avenue, installing some telemedicine equipment there. Also at Camp David and on Air Force One. So he couldn't make it. Dr. Bill Lewis, who is our chief medical officer, would have been here today, but about 8:45 this morning he called me and said he was at urgent care and that he'd poked himself in the eye and he would probably have to wear an eye patch, and he didn't feel like looking like a pirate at this convocation. So let me explain, first of all, what GlobalMed is. We try to combine everything that you've heard as far as technology is concerned and medicine under one umbrella now, connected health, because what we're doing is connecting patients with physicians with technology. In our case, we are primarily telemedicine, and when I even speak about telemedicine, I do want to make sure you understand we're talking about clinical telemedicine. We're not talking about the direct-to-consumer telehealth folks like Teladoc, American Well, and others. We do evidence-based medicine, or at least enable evidence-based medicine with our integrated medical devices. I have not been privy to much of these slides, so if you will advance them, or is this the advancer? Okay, now I got it. No, I don't. There we go. Hard to read that, isn't it? We in the marketing department at GlobalMed try to convince people, please don't overdo it with the text. So I'm just going to pass that one up. And let's focus on the photos. Let's not worry about the text here so much. The image here was taken in South Dakota in early 2015. This was at Avera. Avera is involved with NATO. At that time, there were some officials from NATO in South Dakota. We were invited to participate in a telemedicine exercise in which the person on the gurney here is undergoing an EKG with a Bluetooth EKG that was communicating with our software on that monitor. This provides the opportunity for EKGs in the field. So then in October of last year, NATO did a field exercise involving telemedicine in Ukraine. Why they chose Ukraine? Well, obviously because the Russians had probably invaded eastern Ukraine, so they wanted to make sure that they were showing support for the rest of Ukraine. At any rate, they tried using our telemedicine device called the Transportable Exam Station, which is nothing more than a suitcase with every other medical device that you would normally use in an examination, and they loved it. Now they want to put it in every NATO country for use in natural disasters and civil emergencies. These are the areas that we focus on. These are the different segments. We break them down into government, clinical, and corporate. Again, with the idea of getting access to health care to the patient. This was an interesting thing. This was a deployment that we did in the island nation of Cape Verde off the west coast of Africa. Prior to this, the 9 inhabited islands were separate from the main island of Santiago, and there are 2 main hospitals on that island. So what would happen is, because it's expensive to go to that main island either by ferry or aircraft, people would delay getting medical care until it was really necessary. So then they would crowd these hospitals, and in the corridors, you'd walk down the corridor and people would be sleeping in the corridor because they're trying to get health care. So now the government installed our telemedicine carts and equipment at various places in the islands, so that before you even go to those hospitals on the main island, you have to be seen by a physician telemedically. This obviously gets health care to the patient earlier in a timelier manner, hopefully with the idea that it improves outcomes. This was an interesting exercise. This was at Summit Healthcare in Show Low. Dr. Philip Johnson is the chairman of the emergency department. He uses one of our products, Encounter Cloud, to communicate with specialists in Phoenix when it comes to people who present with some sort of head trauma, an accident, or they fall, or they've hit themselves in the head. And what this does is allow him to find out whether this patient needs to be transferred to Phoenix for health care. And what this also means is fewer dollars spent on emergency transportation, like airlifts with helicopters. So as you can see on that graph, over time, the number of transfers that have been needed has really dropped, because now the specialist in Phoenix can tell him, yes, you need to send that patient, or no, you don't need to send that patient, often before the radiology report comes back. I mentioned the NATO exercise. This is Dr. Rifat Latifi. Many of you may know him from his days at the University of Arizona. He has now left that position and moved eastward, unfortunately to our loss. At any rate, he was present at the NATO exercise, explaining the device you see in the background over his left shoulder, which is the transportable exam station. And the patient on the bed there was getting an EKG with that Bluetooth EKG. The Bluetooth device is sitting right on the patient's leg. We are involved with the VA. The VA has modeled its healthcare telehealth system on our equipment. So we're in all of the VA medical centers and community-based outpatient clinics from Guam to Puerto Rico. Last year, the VA did more than 2 million virtual consults with patients. About half of them they did on our equipment. So we probably set the record for the most telemedicine visits in clinical telemedicine with that. Dr. Bill Lewis would have been very proud to have been here to tell you more about GlobalMed, probably in a better way than I would with all of the details that were on the script. Let me tell you one story, though, before I leave. We talked about telestroke. Jack Porter was the mayor of Bisbee several years ago. In 2004, on July 2nd, 2004, he was talking to his chief of police at his VW workshop. That was what he did for a living. And the chief of police said, "Jack, why are you slurring your words?" He didn't realize he was. He says, "No, you are." He says, "Maybe we should go over to the Copper Queen Hospital and find out what this is all about." So he drove him over to the hospital. Now he's walking in, he's already limping and having difficulty speaking. So right away they're saying, "You may be having a stroke, but we need to do an EKG, and we also need to do, the test, raise your arms and that kind of thing. But first we need to contact the Mayo teleneurologist with our GlobalMed system." So that's what they did. The Mayo teleneurologist confirmed, after evaluating him, "Jack, you are having a stroke. We're going to start you on a thrombolytic, tissue plasminogen activator, TPA, which is the major clot-busting drug used to help stroke patients." So they started him on that intravenously, and you would not know he had a stroke because they got to him early enough in that 3 to 5 hour window, because that hospital had 4 months earlier put that equipment in place and joined the Mayo Telestroke Network. It saved his independent life for sure, and may have saved his life as well. Just wanted to say, I think my 8 minutes are up, or whatever it was that I was supposed to be here for, unless they want me to go farther. Keep going?
Roger, you can tell stories all day if you want to.
Okay. Hey, I can talk about this forever. Telemedicine, as far as our systems go, they're meant for clinicians to communicate with patients in clinical settings. So for example, if you go to an outpatient clinic and there is no specialist there, that outpatient clinic can use our system to communicate, to connect you with the specialist. Studies have shown that a lot of times when you are an hour or 2 hours distant driving from a particular specialist, that you have to make that appointment maybe a couple of months in advance. Well, then there's always a soccer game or something that comes up on the very day you're supposed to take off time from work and ask grandma to come over and watch the kids. So there's a high frequency of appointments that are never kept. With telemedicine, if you make it more convenient in the community, there's a high number of telemedicine appointments that are kept. I also want to tell you about the VA Medical Center in White River Junction, Vermont. All of us pay taxes, so this is going to, in a sense, make you feel pretty good because we've saved you some money. The VA Medical Center in White River Junction did a study of patients who were seen between 2005 and 2013. Again, these are veteran patients. Some 5,700 visits took place telemedically between the community-based outpatient clinics in that area and the VA Medical Center. They saved the average veteran 145 miles driving and 142 minutes in travel time. The VA does reimburse its veterans for travel. So the average travel payment of savings over those 8 years was per patient, or per year, $18,555. And that's significant because the final year's savings, as people began to accept telemedicine more readily, the final year's savings were $63,804. Now, the White River Junction, Vermont Medical Center is not one of the larger VA medical centers. And there are 150 of them from Guam to Puerto Rico. So if you multiply just 150 times $18,000, that's how much telemedicine can save and is saving a year at the VA. And that's dollars that you and I are spending on veteran health care. And that doesn't mean that we shouldn't be doing that. It's just that why are we overspending when all we can do, when we can do telemedicine and bring those doctors and patients together without that patient having to drive and be reimbursed. VA has done a lot for this country. It gets a lot of negative publicity because of the scheduling issues, especially at the Phoenix VA. But that's just one very small aspect of what the VA does, and does very successfully. If you speak to many veterans, they would say they're only alive today because of the VA. And the people who work at the VA happen to be some of the nicest and most professional people in healthcare that you will ever meet. And I guess what I'm doing is speaking up for the VA system here today because they are important to all of us and to our veterans. And I see Joan out of the corner of my eye with the hook.